My name is Dr. James Sutton. I'm a psychologist. My blog, It's About Them, is dedicated to helping young people, but it has drawn a lot of attention through a reference to adults on the subject of ODD, Oppositional Defiant Disorder. The comments to that blog have been interesting and somewhat of an eye-opener. Actually, there is no ODD diagnosis for adults. It's strictly a diagnosis used for children and adolescents. Yet when folks talk about adult ODD, it's pretty clear what they're discussing. The same sort of defiant, argumentative, oppositional, noncompliant, and angry behaviors that are seen in young people. There are a number of diagnoses in the psychologist's diagnostic book called the DSM that closely approximate ODD in adults, but the best one of them, passive-aggressive personality disorder, is no longer in the book. As I understand it, it was removed because just about all of the personality disorders contained features of passive-aggressive or oppositional and defiant behavior. Now, if that interests you, you might do a Google search on it. Before we discuss personality disorders and the like, let me suggest that some adults are oppositional and defiant by disposition alone. It's their temperament. They were contrarian at birth and, well, not much has changed. What keeps these folks from receiving a tougher diagnosis is the fact that they can maintain relationships, stay in a marriage, and hold down a job. They might be difficult, but they're not impossible. Now, there are other psychological conditions and diagnoses other than personality disorders that can account for the behaviors we're talking about here, but they're really beyond the scope of what we're trying to cover. Researchers believe that personality disorders, which are diagnosed only in adults, by the way, have their beginnings in the very young child when something goes wrong during development, such as poor bonding with a parent's inability to nurture the child, abusive relationships within the family, addictive and compulsive disorders, or multi-generational dysfunction. It can affect a child's thinking, levels of trust, and it can even derail a true understanding of right versus wrong. These issues, of course, go on into adulthood. These folks are living in an adult's body, but many of the developmental pieces are either damaged or they're missing altogether. How much is too much? Well, that's a good question. Chronic behaviors of oppositionality, argumentativeness, defiance, negativity, and anger reach critical mass when they result in lost relationships, lost marriages, lost jobs, and more often than not, financial distress. And when additional complicating issues like drugs, alcohol, and gambling are factored in, the outcomes are devastating. Add to this those situations where loved ones live in daily fear for their safety and even their lives, and you have a diagnosis that's gone way beyond ODD. It's criminal. So what do we do? What about treatment? Can these folks change? Change usually starts when there's a fear of losing something important, such as one's marriage or family or one's employment. But that sort of change is directed only at avoiding the loss. Fear is a great motivator, but it doesn't have much of a shelf life. As soon as things are back in place, change stops. If you've ever been there, you know exactly what I'm talking about. And this can happen over and over and over again as it racks up a ton of heartache along the way. It's often quite difficult for a loved one, as well-intending as they might be, to get any real change started. Discussions often end up in arguments, or worse. Professional help and support groups are the way to go. And as I continue, I'll put some websites up on the screen. You might find them helpful. In my work with egocentric, defiant, argumentative, and negative individuals, there are two kinds of confrontation that have a chance to get change started. One is predictability. The other one is something I call fallacy of best thinking. Although these don't work 100% of the time, they could be a good place to start. Predictability. ODD-type adults generally think of themselves as very original, spontaneous, and much more clever than the rest of the world. By contrast, their behavior is quite predictable to anyone who knows them well. Suggesting what they're getting ready to do next often messes with their minds because if they do what's just been predicted, they make the predictor correct. And they certainly don't want to do that. If, on the other hand, they don't do what has been predicted, then the predictor has altered a behavior and deprived that behavior of a payoff. Fallacy of best thinking. Now, I've used this one many times to get an adult to understand the awesome mess their thinking has created. Follow me on this scenario, I might say to them. Let's say you wake up in the morning and you put on the brain that you're going to use for the day. You have two to choose from. One is your worst thinking brain and one is your best thinking brain. Which one would you put on? Well, obviously they would say their best thinking brain. Can you think of any reason why you would deliberately put on your worst thinking brain? No, not really. All right, let's look at the facts. You told me your wife wants a divorce. She has a restraining order on you right now. You were fired from your job last Thursday. 2 of your children won't speak to you at all, and you are buried in debt. Is that correct? Have I overstated any of that? Now, this is not pleasant stuff to look at or discuss, but it's very difficult to argue with the facts. And I would continue. And, just as you inferred a moment ago, you used your best thinking to get where you are right now. What does that mean? Well, the whole point I'm trying to make with them here is that their cognitive resources and how they think and act are faulty and need fixing. But it's best if they can find a way to arrive at that conclusion themselves. They might not fit all the pieces together perfectly, but at least they're looking at the puzzle, and that's a start, and maybe they'll also start to realize they need some help. The real message here is responsibility, isn't it? Adults are responsible for their behavior. Period. The problem is that folks who have major difficulty with their attitude and behavior get upset every time they hear that word, responsibility. When they hear it, it's almost always packaged in some sort of negative. And that's why I try to use the word responsibility in a positive context whenever a patient makes even a small effort in the right direction. One sign of effort in the right direction is the realization that one's attitude and behavior has seriously harmed those they should love, nurture, and protect. I was once a psychologist for a 28-day treatment program for drug and alcohol addiction. Quite an experience, by the way. I would show patients films and videos of real-life situations showing how a parent's behavior had seriously hurt their children. Patients would cry buckets as that began to soak in. It would break the toughest of them. I could show you letters that they wrote, therapeutic letters, not the kind you actually mail. And these letters would have you in tears also. But tears aren't change any more than gasoline is an automobile. Change starts with, I don't want to do that to my kids anymore. Please help me to stop hurting them like that. I don't want to be that person anymore. Anyone who's ever read and worked to apply the 12 steps of Alcoholics Anonymous to their life knows everything I've been talking about here is in those 12 steps. And it's not just for folks who struggle with alcohol, it's for folks who struggle, period. You see, none of us were raised on the good ship Lollipop. But as author Wayne Dyer once said, it's never too late to have a happy childhood. I do hope this has been helpful. God bless.